Black box equals fear box. Everyone's talking about the FDA removing the black box warnings off the medications, but people are kind of like, what is the black box warning anyway? So in this video, I'm going to share with you what the black box warning is, where it came from, and why it matters. Also going to share with you which drug got the very first black box warning, what triggers the FDA to add or remove them, why estrogen was slapped with a warning after the Women's Health Initiative, WHI, in 2002, and what's really changing now that the FDA is removing estrogen's black box warning, and how this might impact you using bioidentical or compounded hormones. So many questions, right? So the bottom line, fear-based labels have scared women out of life-changing therapy for over 20 years, and the FDA is finally catching up, which is really cool. There's so many different agendas. And as a question asker, I'm curious, skeptical, I'm a show me kind of girl. But as a physician, that is my job, is to think of the very worst thing and work my way backwards, right? So if a patient comes in and they have XYZ complaint, I have to go to cancer or brain tumor, and then I work backwards, right? And I think a lot of doctors don't do that because they immediately go to that place where, oh, it's probably nothing. So I operate a little bit different. So if I see a black box warning, I'm very quick to go, oh my gosh, this is really, really bad. And I think a lot of people do too. And we have to dispel some of the fear about understanding what exactly is going on and what this means. So this patient was scared to come anyway about hormones because everybody is because of this black box warning. And she shows me and she's like, oh my gosh, this causes cancer. This it's like so bad. All the things that could cause death. So, as we're kind of working through that, I'm like, she's also on cholesterol medicine from another doctor. And there's no black box warning on that. And cholesterol medication can be very, very dangerous. So, what is the difference? How does something get this scarlet letter that really triggers everybody to just run in fear? So, black box warnings started in the 1960s after a deadly antibiotic reaction. They're the FDA's loudest way to say, pay attention, this can cause serious harm. Of course, it's not dangerous enough and killed enough people that we're going to take it off the market completely because that has happened. But to me, I kind of think about like a stoplight being put in after so many people have had an accident there. So in 2003, estrogen got hit with one after the Women's Health Initiative linked hormone therapy to higher risk. But that data lumped all women together, no matter what age, dose, or delivery method. And now in 2025, the FDA is removing that black box for most estrogen products because the science finally shows the benefits outweigh the risk for healthy midlife women. So let's talk a little bit more about what the black box warning is. It is the strongest warning label the Food and Drug Administration requires on drugs prescribing information, the little packet that comes with your stuff, or it can be on the box of the box, indicating serious or life-threatening risk, death, permanent injury if the drug is used incorrectly, or in high-risk populations. So the presence of the warning doesn't mean a drug is bad or unusable. It means we got to weigh the benefit and the risk very carefully, especially in vulnerable populations, older patients, children, patients with comorbidities, etc. And the rate of adverse events may be quite low, but the severity can be high. One example would be antidepressants like SSRIs. You're probably familiar with Prozac or Effexor. All antidepressants carry a black box warning that used in children, adolescents, and young adults may increase the risk of suicidal thoughts and behaviors. So things like opioids, CNS depressants, things like benzodiazepines, Xanax, muscle relaxers, many carry box warnings about risk of abuse, addiction, fatal respiratory depression, especially when used with benzodiazepines or in non-tolerant patients. So these might not necessarily have the familiar black box, but they will come with warnings on them that let us know that, hey, we need to pay attention to this. Even ibuprofen, like nonsteroidal anti-inflammatories called NSAIDs, have boxed warnings for increased risk of heart attack, stroke, and GI bleeding. And then we get to things for autoimmune, malignant, or serious conditions. And many of the biologics or immunosuppressants, chemotherapy agents, of course, or things for cancer have these warnings as well. It can be added at approval or any other time based on new safety data. So when a drug is approved, it can be added then. Usually not. Usually the accident has to happen at the intersection before a stoplight gets put up, but it can be added at any time. In 1961, the FDA ordered a boxed warning for chloramphenicol because of something called fatal aplastic anemia, and it was cited as the first of its kind. So it was very relatable to this thing popped up, and it was these people who took this drug. In 1979, the FDA formalized the modern boxed warning framework used today. So you'll see both 1961 and 1979 referenced as the first black box. Who regulates it? The FDA and the CDER under the Food, Drug, and Cosmetic Act and labeling regs. And the FDA issues guidance on when and how to write black box warnings. So when does estrogen get a boxed warning and why? In 2003, after the Women's Health Initiative, FDA implemented class-wide labeling for menopause hormonal therapy, estrogen alone, and estrogen plus progestins, including a boxed warning for increased risk of cardiovascular events, invasive breast cancer, and probable dementia. All the things that we actually know that estrogen can prevent. What just changed in November 2025? The FDA announced it will remove the longstanding boxed warning from many menopausal hormone therapy products on over 20 labels because newer evidence shows that the 2003 risk statements were not appropriately stratified for age, timing, dose, and route. How old you are, when it's taken, the dose, how much, and how it's given, and discouraged appropriate treatment to these women. And I will say, side note, it's so sad to me how many women have suffered, but okay, I digress. So the agency is working with manufacturers to strip boxed warnings tied to heart disease, breast cancer, and probable dementia. It's important that the FDA says it's not removing the endometrial cancer boxed warning for systemic estrogen alone products because we know that unopposed estrogen in a woman with a uterus has an increased risk of getting endometrial cancer if she doesn't take progesterone. That's a given, right? We know that, but it's so not related to this because that's how you treat. And it's, when we talk about hormones and hormone safety, it's all about balance. So giving a woman estrogen without progesterone is just going to make her gain weight. It's going to make her estrogen dominant. It's going to make her feel crazy. And it can give you endometrial cancer. So again, I'm not saying all this because it's just like, oh, okay, estrogen's safe. Let's all, no, it has an appropriate place. And if it's used right, and especially in the bioidentical form, has a very different safety profile than synthetic hormones. That's exactly what happened in a 2002 study. They took women that were 15 years out from menopause, put them on synthetic hormones, high dose, and then they did start to see some problems. But synthetic hormones are the same hormones that are made from plastic. So yeah, plastic. So yeah, of course we're going to see problems. We know that there's PCB in plastic water bottles, right? So we know that they're endocrine disruptors. We know that synthetic hormones are very different. So I'm all about keeping that black box warning on synthetic hormones. Very different story with bioidentical hormones, but we're going to get to that in just a minute. So do bioidentical hormones have boxed warnings? So the FDA approved bioidentical called 17-beta estradiol or micronized progesterone. Only those words are bioidentical. So if you're looking at other products, and a lot of women don't understand that you can still get bioidentical hormones from a regular big box pharmacy. So they do carry the classic boxed warning since 2003. So this whole thing that estrogen's not FDA approved, it absolutely is. And so that proves the point that estrogen, bioidentical, is FDA approved, and to the case that it does carry the black box warning, which is changing, and those labels are now being updated per the FDA's new action. Compounded bioidentical preparations, however, do not go through the same FDA approval process. They don't use FDA labeling, and they're not required to display that black box warning, which who knows, maybe even why a lot of women feel safer, because my patient this morning that brought me her black box warning was like, oh my gosh, I read that. I know the side effects. I know the risk, and I don't care. Give me some hormones because she's absolutely miserable. But when it comes to bioidentical, if you do a compounding pharmacy, they are not required to carry that same black box warning. And I think that that's been very beneficial for women, especially once we've gotten into the compounding world, because now they don't have that fear barrier for that very reason. I will say that compounding pharmacies do have to go through standardized FDA approval for their facilities. So they are using FDA approved bioidentical hormones, just like big box pharmacies do. And they are FDA approved estradiol, progesterone. They just don't have that standardized dosing that has gone through that dose for that woman because you can't study that in a randomized placebo trial. So that is bioidentical hormones are FDA approved, but not in the dosing in a compounded, a little estrogen, a little progesterone, testosterone. I call it the cocktail that I often make for my patients. So let's talk a little bit more about the study in 2002 and exactly what happened. We're talking about route, delivery, dose. They took women 10 to 15 years out from menopause, which is just a year without periods. The reason you stop having periods is because you don't have ovarian function anymore. So they took these women with no ovarian production of female sex steroid hormones and put them on synthetic hormones, which are very, very different than bioidentical hormones, of course. They also gave them a higher dose and they used a form called Premarin, which is pregnant mare horse urine derived. And they also didn't account for smoking or genetics or lifestyle. And we know that smoking increases your risk of breast cancer by 800%. We also know that the women didn't get the benefit of having hormones for up to 15 years. And we also know that the risk of breast cancer goes up with age, regardless of whether you're on hormone therapy, because our society went from almost 70% of women on HRT before the 2002 study, then it went down to 30%. And in 2025, we're down to almost 4% of women being on HRT because of the fear. So I'm very, very confident that this small step will make a big, big difference in how women view this. I think for a little while, it's going to rear its little head and be like, what? I'm skeptical. You said it would kill me. You said it would cause breast cancer. And now you're saying we're removing it. And the pharmaceutical corporations have gotten in trouble so many times. They've gotten their hands slapped so many times. They had to take things off the market. They got criminal proceedings and big fines. And they kind of just don't care sometimes because they make so much money that they sort of average out how much money they can make and lose on big lawsuits before they come out ahead. I know, can't make this stuff up, but I will say that I do think this is good, that it's getting the attention that it deserves. And a lot of people are coming out and talking about how many women have suffered without hormones. And the fact that we have the option of all natural bioidentical hormones, I think it's criminal that we're not talking about that. And we're not talking about the options of compounding and individualized therapy as well. Always talking about, I mean, there's a risk to anything. There's a risk to drinking too much water. You can dilute your sodium in your body. There's a risk to too much sun exposure. I mean, there's a risk to everything. So when it comes to symptom relief, quality of life, most women would say, I personally would say, give me synthetic hormones if that was the only thing, because not having ovarian function is cruel. And you think about who gets breast cancer, who gets dementia, broken hips. Do 30-year-olds get dementia? Do they get osteoporosis and broken hips? It is, yeah, no. So, I mean, you think about that. I'm more scared of not having hormones than of hormones. And this fear has been extremely irrational. And the studies, another thing was that there's a difference between relative and absolute data and significance in those studies. They did the study to show that there was benefits on the heart, and that all just went to hell in a handbasket. So that's where we are, to the point that women are suffering. I think the women in that generation, like myself, a little bit older, from 2002 are the scaredest because they were the ones that heard the news. And then now I think it's trickling out just a little bit where not everybody's scared. Think about the fact that synthetic hormones in the form of birth control, no one ever says, this is terrifying, this is going to cause breast cancer. But then yet, when it comes to HRT, we're being withheld that or we're being scared to death and the fear tactics. Another agenda, of course, if you're scared of hormones, that life-giving bioidentical hormone that our ovaries once made, there's a pill for an ill, right? So you think about the bigger picture of big pharma, that if you aren't sleeping, there's a sleeping pill. If you're depressed, they say, oh, you're just depressed. Here's your antidepressant, or here's your cholesterol pill, or here's your anti-inflammatory. And there's a drug for almost everything. So the agenda is a little bit bigger than we think. I do feel like some of that was trying to protect women because doctors who don't realize what they're doing, it's kind of respecting electricity. And I don't really mind that there is a black box warning, but the black box warning should be on the provider and not on the estrogen. I will also say, just in closing, that there were three different groups: estrogen, and estrogen plus progesterone, or progestin, the synthetic progesterone, and a placebo group. And the women on estrogen, if they got breast cancer, they actually had better morbidity and mortality. So there's so much more to the story. I'll be brief about this, but I just want to share with you what the black box warning is, where it came from, and why you shouldn't be scared for bioidentical hormone therapy, and really explore that. Truth is power. Education is medicine. Love you very much. Please don't let them use fear to control you. Use your knowledge to get your needs met. Preventive, take care of your symptoms, and be the best you ever.